Hello everyone, my name is Danielle, and I'm going to be talking about the different occupational therapy interventions and their effects on mental health symptoms. Mental health challenges have become increasingly common in recent years, with 1 in 5 adults experiencing mental illness and half of these symptoms starting before the age of 14. With this increase, the general public's knowledge of mental health has also increased, but still many do not know that occupational therapy is a possible treatment for mental health symptoms. My research aimed to look at multiple OT interventions and their effectiveness in treating mental health. This is important for practitioners. Having a wide range of knowledge on the different interventions allows the practitioner to cater their care to the individual's needs. It's also important for patients. Patients who may not seek traditional talk therapy should know that occupational therapy is an effective option for their mental health symptoms. I looked at traditional OT interventions, which focus on activities of daily living and job assistance. I also looked at the tree theme method, which focuses on art therapy and life storytelling. I looked at balancing everyday life, or BEL programs. This focuses on activity balance, motivation, healthy living, and relaxation. All three of these studies saw increases in satisfaction in activities of daily living, increases in sense of coherence, sense of control, and increases in quality of life. The tree theme method, compared to traditional OT, saw more increases in sense of control, and BEL programs seemed to be more time effective than traditional OT therapy. Hippotherapy was also looked at. This is therapy that involves a horse, which encompasses both emotional, mental, and physical domains. It saw that those with PTSD symptoms had lower symptoms after therapy. I also looked at play-based occupational therapy. This looked at children diagnosed with cancer and catered care to their individual play interests. They found reductions in anxiety, feelings of insecurity, and increased positive emotions. Lastly, I looked at telehealth, which is probably the most relevant nowadays. Telehealth saw that OT interventions over video chat helped aid in relapse prevention in different mental health disorders. Future experiments should look at more major depressive and anxiety disorders, since the ones that I went over looked at minor mental health symptoms. Overall, the findings showed with increased physical activity and dependence, self-esteem also increases. This increases a sense of quality of life. Having increased sense of quality of life positively impacts mental health by lessening symptoms. I learned from these findings that the mind and body are way more connected than we think. Occupational therapy accompanies both the body and the mind to effectively treat mental health symptoms. I found that all these different interventions focused on one thing, which is increasing self-efficacy, which helped lower symptoms for those with mental health challenges.